And welcome back to Health View. This is Dr. Angela Ruff, and again, our topic today is how to keep your kid out of the ER in a healthy way. And our guest again is a pediatric specialist, Dr. Felicia Baxter. Tips here. So, Dr. Baxter, joining us this morning.
No problem. It's great being here.
Well, super. Well, I know you have a lot of good advice for parents out there of how to keep their kids healthy and away from the ER. And you certainly have been in pediatric emergency medicine for many years, so you have seen it all.
Exactly. Some things more than others. But,
right.
With peds, people have to understand is there's not, unlike adult medicine,
right.
But there's a lot of things done to them and a lot of things that they have no control over.
Sure.
And there's been a lot of things said in the media that I think I just wanted to touch a little bit basis on. I want everyone to understand that these are just my opinions. It has nothing to do with the AMA or the AAP. These are some of the things
very educated opinions based on definite street knowledge of what you see in the ER, and you've been in different states. You used to commute to Texas, right?
Actually, I still commute to Texas, not as often as I have been.
Right.
For like the last 2 years, I've been an independent contractor at Children's Medical Center of Dallas, where I've actually did my residency.
Right.
And that's it's not really being in the trenches. I don't want to say it like that.
Sure.
But I had the opportunity to work in the inner city. And that particular hospital with Parkland Hospital is like a major referral center, not just for like North Central Texas, but also for Oklahoma and some of the other border states. So we see a lot.
Yeah, and you probably have illegal immigrants and their kids, so they didn't have the benefit of vaccines and things
exactly.
like
that. And I'm going to touch on immunizations a little bit, but just because of where we were located, it seems like we were a corridor right through Houston from Mexico and a lot of Central America. So not only did I see completely unvaccinated children, but just some of the diseases with a twist, because by the time they got to our hospital, they had not and it was just because of they just didn't have access to medical care. We are so blessed in this country to have access, and when they come from places that there's nothing.
Sure.
And for example, MRSA, I wanted to talk to you a little bit about that.
And that's definitely been a buzzword in the media.
Right. And those 4 little letters have really struck to the heart of health administrators, county health officials, health departments, and you've seen some of the basically entire town in Virginia. But some things get out to the media a little bit late, and I'm not sure if they were just searching for news, but this particular bug is not news. It really isn't. And just to go back, MRSA actually stands for methicillin-resistant staph infections. Maybe about 10 years ago, they would cause just minor skin infections and some other infections. But at the same time, this particular bug is not a super bug. It's just a bug that's kind of smart. It has been able to be resistant to this particular antibiotic, methicillin, or just the group of penicillins across the board. So don't work with this particular bug. And also another class of antibiotics called the cephalosporins, like Rocephin and Keflex. Broadbands. This bug has, for whatever reason, had developed resistance to it. We used to just see it in ICU patients, PICU, which is the pediatric ICU, as well as in adult ICUs. But in the past 10 years, there's been an increased incidence in the community acquired. The reason why we think that has become so. But for example, when I was a resident, because of the illegal pharmacies, there's a flea market in Dallas where you could actually buy penicillin and amoxicillin for about $10. And they would run it up from Mexico. And they would set up in the flea markets, and you could go and get prescription grade, things like that, and overprescribing antibiotics has been associated, I think, with the uptick of this particular.
The American Heart Association changed its recommendations about pre-med needed for basic dental treatment, and they really, a lot of people now do not need a pre-med based on their studies rather than did before.
Exactly, and that was mostly for the heart patients and for vascular disease, etc. They would suggest that for a couple of days or so, or you would get one dose or several days of amoxicillin, but they realized that you probably don't need that, and maybe things like those recommendations
I think probably
contributed to this particular bug. But if you ever hear the MRSA or MRSA, that's what they're talking about because they have a resistance to it.
So how can parents help their kids not suffer from this?
Just like the common cold, this bug, believe it or not, in the community, contact with contaminated surfaces, whether they be clothing, gym equipment, hiding your nose, those things, just good hand hygiene. There was a study of a major health system in Canada of MRSA by like 75% just by washing hands.
Yeah. I tell you, I was just flying back this past weekend from New York, and the lady that was sitting next to me, she was coughing her head off and sneezing. And I'm in the middle seat, okay?
One, as a frequent flyer myself, never. Always book early and always get the aisle or the middle and get you some Purell.
Trying to get my little scarf and kind of make it to Baxter. I was trying not to be rude, but I was like, I didn't want to be sick, you know?
Yes. And it's nothing, and some of the things that you can do once you get off the plane about things, one, washing your hands, Purelling your hands, but also ENT doctors tell you this, to decrease, I honestly think decreasing like fomites, like thing for like allergies. They tell you to do nasal washing, swelling in your nose. Basically, it washes out
the
junk.
Bugs that got in there.
Yeah, that's in your nose, and that would make sense that you would need to do something for it, especially this time of year. I'm actually really kind of I have a flight soon, and I remember I picked my seat, so I think I should be okay.
Yeah.
But
our problem was it snowed, and so they canceled our flight, shuffled on to another flight.
Exactly.
Really,
and
really
just to sneeze. I remember being sick on the airline and coughing and coughing and coughing.
Yeah.
So you won't contaminate the entire
airplane. Yeah.
So.
Next time I'm going to take one of my masks with me, I think.
Because you don't want to go that route. But,
Oh, well. But, here I should have been empathetic for her not feeling so well.
Then at the same time, I got to work. I cannot afford to get sick.
That's right. That's right. So then as a preventive mode, moms are trying to help their kids, then to, make sure, obviously, Johnny washed.
Like some kids, like they share coats, clothing. I would say also if they are in a type of sport where they have to use equipment, make sure they help out with cleaning the equipment. Let me back up. The incidents in Virginia happened because there was a young child that actually died away with overwhelming, probably MRSA septicemia, and they think he picked it up probably from one of his classmates, and he could have just gotten it through contaminated gym wear. By making sure those types of surfaces, like the hard surfaces, are clean effectively, dilute. Mostly it's dilute bleach or some other antibacterial solution that can be removed or replaced frequently. Those types of things. If you know your child has a leech, like a weeping boil or some other type of weeping skin condition, they really should sit out. Because MRS abscesses, or it can give you kind of like impetigo, where they have multiple clustered leaf and they're infected until it's completely crusted over. Not every child that has one little pimple, I think certain things, if the leash, because they can go really fast until they can be drained, or if it's just getting worse, staph or some other, like also strep, those are the only kids that really need to be on antibiotics.
And so some things, I know we've all probably gotten splinters and things like that. So just some basic things from get splinter out.
Get the splinter out and clean and just wash with a mouth soap.
And
seek medical attention.
Peroxide, would that be?
A dilute peroxide solution, or we don't suggest a lot of alcohol solution. So it damages the skin, which could actually make the lesion worse. So
I see. I remember it seemed like I was always falling as a kid, and they always I think we bought the peroxide by the gallons.
By the gallon.
Yeah.
I was a big klutz and I was a tomboy, so yeah.
I was like, I know I'm going to finally be grown up when I quit stubbing my toe.
No, it doesn't happen that way.
Oh well, but yeah, peroxide that doesn't burn your hand.
And just a simple soap, either Dove, Dial, whatever you have at home, and just a mild soap, plus or minus the Band-Aid. Sometimes if it gets too wet underneath the Band-Aid, if you have a sweaty kid,
sure.
You sometimes just...
And, I think another... I carry Purell in my... you can't get to the bathroom to wash your hands. So, but that's probably...
For a minimum of 2-3 minutes.
Yeah.
And also... smaller children and even teenagers, you may want to just also keep their nails kind of short and clean. Pickers, so
and we're not talking guitar.
Yeah, they just an eye on their nails and making sure they clean their hands, that kind of thing.
Okay. To help avoid showing up at your clinic.
And most of the time, and also sometimes you've done everything.
Sure.
You've nuked your house basically. And it can still get worse.
Yeah.
And I think some parents just have to understand some of the things to worry about. You really start getting worried if one looked like a bug bite and then the next day now the area has quadrupled in size.
Yeah.
Or and the child now has a fever. Those kind of things it's just don't pass go. You have to go to the ER. Or you just have to at least call your physician and let them know what's going on.
What's happening there.
Correct.
I think be too, I guess the word I'm looking for is too anxious to overreact.
Correct.
Neglectful either.
Right.
So they're not sure, okay, what are the guidelines they use? That was really helpful to help them, as far as, skin lesions. But I don't know. I know my parents were like, then we're taking you to the doctor.
You don't want to get to that point.
We'll make sure you're not faking it.
But then most people don't know that with this particular infection, it has a higher incidence not only in certain parts of the country, but also within certain races.
Yeah, well, like...
Just for example, African Americans, there's a higher incidence of, for whatever reason, MRSA in our population.
Yeah.
And
is predilection?
Yes, males.
Males. Okay.
And there is an age predilection in older individuals. So if you're older, like over 65, African American, if you have, you may have MRSA. So we just really need to keep an eye for that particular. Usually, there's another peak little bit after a year, and then it's associated with certain times of year, like if they had like a pre-existing cold prior to the start of this whatever part of the body infection, that seems to be the course of the disease.
Is there a relationship between this and diabetes?
Chronic disease can basically set you up for any type of horrible infection if you have already neuropathy and horrible perfusion to your extremities. You're probably a little bit more set up for it, in addition to yeast infections and anything like that.
Sure.
CF, cystic fibrosis kids, heart kids,
right.
Those kids and also premature infants. If you've ever been premature, your incidence of having some type of really invasive infections are probably a little bit higher too.
I see. Okay. And that carries on. I didn't realize that. Okay. We were talking earlier about how the fact that with medical technology they're able to save babies that they couldn't beforehand, but that comes with it a caveat
because they got out of their neonatal period with there's some serious things that can happen, other risks that we have to watch them out.
Sure.
Developmental delays, if they've had a similar, like a stroke, or they had a bleed into their brain, they are at risk CP developmental delays. Sometimes those problems with their lungs, they're at risk for having problem with their digestive system. It's called necrotizing enterocolitis, or just NEC. Another letters, 3 letters you really don't want to hear as a pediatrician.
Right.
And they also, because their immune systems are not as strong when they're in the neonatal period, and what we do to them with all the IVs, central lines, and ventilators, they're usually set up more so for different type of infections too.
Right. Well, that's really some great advice, and I'm certainly learning a lot here. So I never had kids with worries.
Some of the stuff, if you ever had a puppy, a lot of it's a little bit similar. You just stress out the same amount, I think.
My dog, she jumped out of the car while I was going. But we will be right back. We're going to take a quick break for the sponsor, and we'll be right back after these messages. You're listening to Talk with Healthy. This is Dr. Angela Ruff.